Good day, dear friends. Natalia here on the Dr. Savkina channel, where I share my personal experience, answer your questions, and conduct individual consultations. Today, we will talk with you about blood thinners. In this, I will focus on the selection of simple and accessible means that you can use at home. I'll start perhaps with the fact that tablets for thin blood cannot dissolve already formed blood clots on their own. However, they are capable of reducing the blood viscosity and thus preventing thrombus formation. All drugs that prevent the formation of thrombi can be divided into two groups. Anticoagulants are drugs that slow down the process of thrombus formation. An example of these drugs is the well-known aspirin. Antiplatelet agents are agents that prevent an increase in blood coagulability. In any case, it is categorically forbidden to choose these or other drugs for yourself independently, without agreement of the treating doctor. In addition, against the background of taking a whole range of drugs, side effects from bleeding gums and insignificant nasal bleeding can occur, up to serious problems which are bleeding in the brain and gastrointestinal bleeding. Moreover, blood thinners are often prescribed to elderly people who already take a large number of drugs to lower blood pressure, sugar, and have been taking non-steroidal anti-inflammatory drugs for a long time. And do you know that non-steroidal anti-inflammatory drugs, often prescribed by doctors for joint treatment, themselves sharply enhance the effect of blood thinners, thereby contributing to the development of bleeding in the shortest possible time from their appointment? The question arises, what should those for whom the prescription of blood thinners is generally not recommended do, due to a number of reasons? Or already has a bitter experience of their use? Fortunately, nature itself has taken care of the application of quite effective methods to thin the blood. There is a whole range of products that act as anticoagulants in themselves. In other words, they prevent thrombosis. These are well known to all of us. Cranberries, black currants, lemon, garlic, beetroot, ginger root, and green tea. And turmeric has the most potent blood thinning effect. The spice, which contains curcumin, is a natural anticoagulant. Milk, dairy products, and potatoes thicken the blood. Alcohol and beer in particular significantly increases blood viscosity. It's not a coincidence that a period of prolonged drinking often ends very sadly with the development of a stroke or heart attack. A reliable method for thinning the blood is Hirudotherapy, in other words, treatment with leeches. Before their appointment, it is necessary to have a finger prick blood test and pay attention to such two indicators as the level of erythrocytes and hemoglobin. A low level of these indicators is a contraindication for the appointment of this treatment method. To thin the blood, herbalists highlight three effective means. This is dandelion, white willow bark, and horse chestnut. When using them, you need to follow two main principles. Firstly, only use pharmacy-grade products, and secondly, do not combine them with blood-thinning medications. In addition, you need to consider the fact that all three remedies can have a negative impact on the gastrointestinal tract. The approach to treating these injuries should be highly individualized in each specific case. The issue of blood thinning should be taken very seriously. Thick blood is one of the causes of serious disasters, strokes, and heart attacks. The most common recommendations for combating this problem for each of us are: first, it's the consumption of at least 1 liter of pure drinking water a day. Specifically water, not juice, tea, coffee, or any other possible drinks. The golden rule of drinking 5 glasses of pure water a day, the first of which should be drunk in the morning on an empty stomach, really working in this situation. And with you, how can we find out that we consume an insufficient amount of pure drinking water during the day? Very simple. You need to take a general blood test from your finger and pay attention to such an important indicator as hematocrit. If it is above normal, it means your blood is thick and it may need to be thinned. To thin it out. For this purpose, it is also necessary to reduce the amount of salt and sugar consumed in your diet, and also to fight hypoxia of the tissues, which causes blood thickening. To achieve this goal, you need to move as much as possible. In other words, lead an active lifestyle. For those actively interested in herbal medicine, I will dedicate one of the following videos to 3 effective herbs actively used for blood thinning, and I will talk about ways to use them. Subscribe to my channel so you don't miss many new interesting and useful videos, and be healthy.